Addiction to heroin and other opiates, including certain prescription painkillers, is impacting the lives of Americans in every state, in every region, and from every background and walk of life, and all too often with deadly results.
Today, America's drug czar asked the United States to face a fact. Put simply, with the help of our doctors, we've become a country hooked on prescription pills. 80% of all the prescription painkillers taken in the world are taken by Americans, and that's in the world. The toll in 17 states and Washington, D.C., more people now die of prescription drug overdose than car accidents.
Really, what we're hearing from kids is these are household products. These are things they're getting from mom's medicine cabinet or friend's medicine cabinet, and they believe very truly that it's a safer way to get high, which is a real falsehood.
Why? How can you dissuade them of that notion right here?
Well, clearly, when you abuse prescription drugs in the same way that you would have used illegal street drugs, they are every bit as dangerous and every bit as deadly as the street drugs.
And every bit as addictive.
Every bit as addictive given what the drug is, particularly prescription painkillers.
1 in 4 teens admit they've misused or abused some form of prescription drug at least once. That's a 33% increase over the last 5 years. What's even more shocking, almost 1 in 4 teens say their parents don't care as much if they're caught using prescription drugs compared to getting caught with illegal drugs.
Bringing attention to a heroin problem that is exploding among people in all walks of life across our country.
So what we do know is that heroin use is soaring.
New Jersey has a heroin crisis. Young people using at such alarming rates, it's becoming a public health concern.
The parents are buying coffins and burial plots.
That's why Cass Foster and other moms and dads whose kids died from drug overdoses gladly welcome the new report from a special task force, an unflinching look at New Jersey's heroin and opiate addiction epidemic.
Here we have the purest heroin in the entire country. And fortunately, we also have the cheapest heroin in the entire country.
That upscale suburban community on the Jersey Shore, Ocean County, has suffered 107 overdose deaths this year alone, most of them from heroin, many of the victims 18 to 25-year-old middle-class kids. Ironically, they are using heroin, ladies and gentlemen, because it is dirt cheap, it is amazingly powerful, and it's easier to get your hands on these days than the prescription drugs that the kids were abusing. Kids like Angela, not a kid, a young lady, she started at the age of 16 with Xanax and Percocet. By the age of 18, she was on to OxyContin. At 20, she started on heroin. Why heroin, Angela?
I think it's important to realize that drug addiction does not discriminate against anyone.
And those pills on the street, 20 bucks, 25 bucks, and I may have missed the first speech. You know what's cheaper than that? Heroin. Way cheaper than that.
The conference is called the first annual Do No Harm Conference, keeping it safe and legal in the medical community, dealing with the prescription drug epidemic in our country. There are experts from across the country here, federal, state government, nonprofit community, clinicians here at Hackensack to deal with this problem, to talk about its impact, particularly on young people. It's especially a problem here in New Jersey.
Because we're all in this together, and I think that if we all engage in this conversation in meaningful terms, that we really can make a significant difference in reducing abuse.
Some of us who've never been involved in drugs can't understand it, but we know. It touches almost every family.
And what people have to realize is that in America, there's probably 40 deaths a day attributed to the overdose of prescription drugs.
And now heroin has come back to bite us on the butt.
Well, Geraldo, what we have found is that the main reason that so many people are impacted by heroin in New Jersey is because they started using prescription drugs. And these prescription drugs became so accessible because most of our homes are full of medicine cabinets with these drugs. And for a long time, young people didn't understand the consequences or the seriousness of these prescription drugs.
collectively, we were just uninformed. You know, we're just uninformed, and we really didn't know what to look for.
And in a way, you don't want to know because it's so scary. You try to talk yourself out of the thought that there could be something wrong.
As a parent, I think the hardest thing to admit is that your child is a drug addict.
There were warning signs that I now know when I look back. You just don't put a face to it, that he's tired and a little cranky, a little bags under his eyes, you know, his room was disheveled, and then we noticed that, you know, his friends were changing and he wasn't calling them back. I didn't realize that nodding is really the #1 sign for heroin, opiates, and if I had known that, I would have known a little earlier that that's what he was doing, and that was it. He was addicted.
It affects the whole family.
Absolutely.
Like you guys were saying, the whole family. We were all upset in so many different ways, you know, so many different ways. You know.
And people have to realize that it can happen to them.
It can.
Because it happened to us, and parents don't think it's going to happen to them.
No.
Our children didn't think it was going to happen to them. The community, everybody just kind of sweeps things under the rug, and it can and it does. I mean, it happened to us.